With health news, as COVID cases are increasing across the state following the discovery of a new variant. News 19's Nate Stanley spoke with a doctor today. He's in studio tonight with more on what you and your family need to know. Nate?
JR, I'm told the severity of symptoms for this new variant, well, they're not as bad as earlier ones. However, one doctor says it's worth paying attention to as we head towards fall.
But it's becoming more predominant now than the other previous strains of Omicron.
DHEC medical consultant Dr. Jonathan Kanuka says a new variant of Omicron known as EG.5 is increasing COVID-19 cases across the country and in South Carolina. According to DHEC, a month ago, the state saw 74 hospitalizations from COVID. Now that number has increased to 107.
It looks like it's more transmissible. It doesn't look like at this point that the severity of illness is any worse, but it's causing more infections, and we're starting to see a little bit more activity in the emergency departments.
Kanuka explains one school in South Carolina is already feeling the COVID woes with a breakout occurring inside a third grade classroom. He declined to name the school or district, but says 5 students tested positive.
Really, in the last month, we've seen the rates of COVID in pre-K kids, elementary school age kids, middle and high school kids kind of double in the last month, I would say. The numbers are overall lower than they have been in the past, but kids that are pre-K under the age of 5, less than 3% have completed their vaccine in South Carolina. So that's the group that we're seeing really start to increase the most right now.
He says there's another vaccine in production expected to roll out in September and says it should protect against the new variant. However, he adds basic safety steps can protect you and your family.
Practice good hand hygiene, cover your coughs, don't go to work or school if you're sick.
For Julia Iredell and her friend Emily Whistler, hearing the news about the increase in cases doesn't come as a surprise, but does have them focusing on staying safe before classes start in fall.
I'm not surprised because I feel like there's always something going around.
Like, used to it. Like, it's not going to surprise me if they're like, we need to get vaccinated again or something.
Yeah.
Dr. Kanuka adds that parents should also be on the lookout for a new RSV vaccine that was just approved by the CDC and FDA. He says there should be available for children here sometime in the next few months. Reporting in studio, I'm Nate Stanley for News 19, WLTX.